how to minimize the complications of mesh in hernia repair surgery.
Hi guys, I'm Dr. Andrew Iraniha from Surgical Oasis Institute. I want to talk to you about how I minimize the risks and complications related to the mesh placement during my surgery. And I have more than 20 years experience about hernia repair and placement of the mesh. My practice is dedicated to the hernia repair. So over the last 20 years, I went through different type of hernia surgery, and I gained a significant experience about how to decrease the possibility of complications related to the mesh placement. So one of the major issues, for example, for mesh placement is developing infection after the surgery. So to prevent that, I go through a very detailed ritual to decrease the possibility of infection, from minimally invasive surgery to place the mesh into the pocket behind the muscle, to use the antibiotics IV, and also irrigating the mesh with the antibiotics prior to the insertion into the abdomen, and many other little rituals that I go through in order to decrease the possibility of a mesh infection. The other thing we do to prevent the mesh complication, including the recurrence of the hernia and adhesion of the bowel to the mesh, and also decrease the possibility of hernia recurrence, is to place the mesh behind the muscle with minimally invasive surgery. So using a smaller incision away from the hernia, entering the abdomen with a scope, and creating a pocket behind the muscle and the defect, and placing the mesh into the pocket and closing the defect with the intra-abdominal structure, which is basically your own intra-abdominal covering called peritoneum. We basically separate the mesh away from the bowel to prevent the adhesion formation, number one. And number two, this area is away from the nerve, and the possibility of mesh create a scar tissue around the nerve and cause chronic pain is extremely rare in this type of operation. By doing the procedure this way, I can use a bigger mesh to cover the defects in an appropriate condition, so prevent the recurrence of the hernia. So allowing the mesh to stay in that area also helps to prevent the mesh movements and again decrease the risk of recurrence. So for more information about the hernia repair and how I perform the operation to decrease the possibility of complications, please contact my office at 949-646-8444, or go to my YouTube channel at Surgical Oasis Institute to see actual hernia surgery videos, or look at my very comprehensive discussion that I have about that.